Chris Tanti is the former CEO of the National Disability Services. This is the body that represents the organisations that provide care for people with disabilities. He was the CEO until February this year, and before that, he worked extensively as CEO in not-profit companies like Headspace and in other mental health and drug and alcohol services as well. During the election campaign, Prime Minister Scott Morrison identified fixing up problems in the NDIS as one of his biggest priorities should he win office. I chatted to Chris Tanti a bit earlier and asked what he thinks are the biggest problems facing the sector that need to be addressed. Have a listen.
Well, I think for a long time, the sector went through a process of deinstitutionalisation, and I guess what we're seeing now is the next generation of deinstitutionalisation. So the problems largely, I think, are around the checks and balances in the system, and I think this is why a Royal Commission is going to be very important. There have been limited checks across the system of care, and people with disabilities and their carers have been complaining about this for a long period of time, and I think that's probably the biggest issue facing the sector and facing people with disabilities. There are a whole range of other issues, particularly the establishment of the NDIA, and that's been around for 6 years now, and people are still struggling with benefits. The sector itself is struggling with a whole range of issues around pricing. So it is a sector in a state of flux.
The NDIS Quality and Safeguards Commission report released just a few months ago identified abuse and neglect and even sexual misconduct as a really significant concern. There were hundreds of incidents that it identified as a significant concern in the sector. Did you in your role see this as a really big problem? Did you hear about a lot of these cases? And I'm speaking about actual reportable incidents, not just complaints.
Yeah, no, in my role in particular, dealing with service providers, I didn't, I would hear from some service providers that it was likely to be an issue and that it was largely a legacy issue. But I think what that Quality and Safeguards report tells us is that it's not a legacy issue at all. It's a contemporary issue. And that report only covered 2 states, so it was New South Wales and South Australia. So once it has national coverage, I think we're going to see that number blow out quite significantly. Certainly when it came to advocacy groups would talk to me about this a lot, the disempowerment of people with disabilities and the range of abuses that took place. And there were some service providers who in fact detected abuse at the hands of their staff against people with disability, and they were dealt with fairly swiftly. So it is an area of significant concern, would be my view, and certainly would be the view of consumers and advocates.
We don't really hear enough about this. I mean, people with a disability are the most vulnerable in our society, and to think that they are being abused by their own carers who are paid for with taxpayer funds is just shocking.
Yeah, no, it is absolutely shocking, and I think this is what happens in a system that hasn't had sufficient checks and balances, sufficient regulation. The model that we're moving to, the NDIA model, is about consumer choice and consumer preference, albeit it's a very complicated model at the moment, but it's starting from the right frame of reference that consumers can determine what they need themselves, and they don't need to be told what it is they need by service providers. But when you have a system that essentially, as you say, is dealing with incredibly vulnerable people, and there is no oversight of that system, then bad things are likely to happen.
So you, in your role as CEO of NDS, you represented the organisations that actually provide the care for people with a disability, 1,000 of those organisations. During your time there, did you see any issues of misuse of taxpayer funds, the funds that were meant to be going for the care of people with a disability?
Well, certainly I was surprised by some of the dinners that I attended, and they were quite lavish by health sector standards, which was the sector I'd come from. And there was certainly, certainly within the organisation, people had talked about the largesse, I guess, if you like, of some in the sector. Overall, I would have to say that the majority of people in the sector are there for the right reasons and perform well, and most service providers have the right intention. But again, it's an oversight issue, and if there isn't enough oversight, and I think these things get lost in the average P&L, if there isn't enough oversight of expenditure, etc., things will go astray.
You mentioned the word largesse. Can you describe some of what you witnessed or heard about when you were working in the sector?
Well, certainly the use of chauffeur-driven cars I thought was a bit rich, really, given that, if people have an issue with taxis, and, I think we've all had our challenges when it comes to taxis, but, we now have a reasonable system in place with Uber where people can get very, effective and efficient services. So the use of chauffeur-driven limousines was pretty extraordinary by some. But again, these are not widespread practices, but they do exist. And, and I guess when I looked at some of the balance sheets of some of the organisations, yes, we do need reserves in place to make sure that we're running organisations, and we can anticipate from time to time there are going to be challenges. But some organisations had very significant balance sheets, very significant land holdings, and I guess at the end of the day I wonder what else could have happened with that money.
Land holdings from taxpayer money, from money that was meant to go for the care of the disabled?
Certainly from state government. So it was a state government funded system largely, and yes, no, these are all taxpayer funds.
And you mentioned some of the dinners you attended or that you heard about. Can you tell me about some of these as well?
Oh, look, I mean, in non-profit circles, it's an extravagance really to go out for dinner. But when some of those dinners consist of multiple courses, then you've got to wonder what the value of them is. I certainly was surprised at some of the hotels people would stay at, and the restaurants that were attended.
Well, 5-star hotels, expensive restaurants, what are we talking about here?
5-star hotels, yep.
Look, it's pretty extraordinary, but just before we move on to the other issues with the NDIS, how did you stand up, or did you stand up to any of this conduct that you're describing now? Where were the auditors?
Well, I guess my comments were that I thought some of those things were unusual and stand out, unusual, and so I would reflect that in my comments.
Now, just in terms of concerns which have become very apparent, that a lot of families or people with disabilities are missing out under the new NDIS system. How cumbersome is it for families to deal with the new system, and how can this be fixed?
Well, I think it is a fairly cumbersome process, and with 12-month review points, which is interesting, because it feels to me like people are thinking that largely this is a recovery-based model. I think if you've got a lifelong disability, then you have a lifelong disability, and you have the challenges that go with that and the expenses that go with that. And 12-month review points don't make a lot of sense for the majority of people with disabilities. I mean, we do know that people can progress, and we do know that people's needs change, and so review points are useful from that perspective. But a lot of the comments I've heard from people with disabilities and from their families is that the review points were cumbersome, the application process was cumbersome, there was an inconsistent approach to the needs of one person with a particular disability and then someone else with the same sort of disability. So, I guess these are the problems, these are the teething problems with any new system of care, but we're now in the system for 6 years, and you would think those things would start to level off. It is still ultimately the only way to go, I think, to have a national system, a national insurance system, so people get the support they need. But it is fairly cumbersome for people to navigate.
Chris Tanti, we are almost out of time, but what do you think some of the key things that the Royal Commission will expose when it does look into the disability sector?
Well, I think the fact that the government has allocated the same amount of money that they allocated for the Institutional Abuse Royal Commission is significant. I think we are going to see, I think the Quality and Safeguards report is a snapshot of some of the things that we're going to see. So we are going to see abuse, neglect, sexual abuse. We're going to see a whole lot of horrific things that have happened to people. And, I guess that we have heard of some of those things in the press over the last 12 months. We're going to continue to hear more of those things. And it's very sad for people who, as you say, are the most vulnerable and who rely on others to care for them. And those people let them down.
Just lastly, do you see that this is an area that private equity is waiting to find a way to exploit?
Oh, look, certainly, in conversations that I've been having and approaches that that have been made to me, yes, I think, there are a whole lot of disruption or disruptive opportunities within the disability sector, and I think people with disabilities would welcome that. So, yeah, look, I think people are just getting organisations are getting a lay of the land. I think there's going to be a whole lot of consolidation in the sector. I think some of the smaller service providers will be running businesses that just aren't financial under the current system. So we will see some significant change going forward.
Thank you very much for your time. I really appreciate it.